Hi, good evening from day one at ACR Convergence 2021. This is Dr. Eric Dein from the Institute of Rheumatic and Autoimmune Disease in Summit, New Jersey, reporting once again for Room Now at another great conference. We have lots of excellent sessions today. Particularly, I wanted to point out one great poster session this morning on rheumatoid arthritis and cardiovascular disease. There are many posters on rheumatoid arthritis and atherosclerosis, hyperlipidemia, and much more. So I encourage everyone to check out the many posters there. Two of the ones that I wanted to point out today. The first one is abstract number 0269, which looked at RA autoantibodies and the risk of incident cardiovascular disease in US veterans with rheumatoid arthritis. So some of the backstory was they know that antibodies to malondialdehyde acetaldehyde, bit of a tongue twister, anti-MA or anti-MAA, has been shown to associate with cardiovascular risk in a non-RA population. We also know that these antibodies can be found in rheumatoid arthritis, but the role of them were uncertain in the RA risk. So this is a veterans RA registry. It's a multi-center prospective cohort. It included nearly 2,400 patients. As it being a veteran population, it's mostly older white males, about 90% male. And of this population, they found that prospectively, 388 developed major adverse coronary events and 220 cardiovascular related deaths. They found that rheumatoid factor and CCP were more strongly associated with cardiovascular deaths than they were to MACE events. And they found that of the anti-MAA, there's also a association with cardiovascular death in the anti-IgG and the anti-IgM anti-MAA. The anti-IgA was not associated. They also looked at ACPA subtype and found that citrullonated apolipoprotein E, biglycan, fibrinogen, and filgarin were associated with increased cardiovascular death. So I think some interesting information, definitely a unique population being in the veterans community, but I think it looks at new antibodies and definitely shedding some light as to the role of both the rheumatoid factor and CCP antibodies, as well as some more novel antibodies and the role of potentially leading to cardiovascular disease in our patients. Secondly, I want to talk about abstract 0271, which looked at rheumatoid arthritis disease activity as an independent predictor of left ventricular mass changes in an RA cohort without cardiovascular disease. So this was looking at 164 RA patients without any cardiovascular disease, but with RA, who had a cardiovascular clinical assessment and a TTE at baseline. Of the 164 patients, they also had return TTEs of 64 patients 3 to 6 years later. So by doing a three-dimensional transthoracic echocardiogram, they were able to calculate left ventricular mass. They found that up to 35% of patients had abnormal left ventricular geometry at baseline. Again, these are patients with no known history of cardiovascular disease, and that 35% increased at follow-up to 55%. And the significant finding that they find is that the increased risk of having the LV mass changes is correlated with RA disease activity. The pattern of the LV geometry was a concentric remodeling, which showed a statistically significant increase. So this is important, again, along with the whole, number of studies that were presented of the risk of RA on heart disease, of effects on the left ventricle, of carotid atherosclerosis, of all the different effects that rheumatoid arthritis, in particular rheumatoid arthritis disease activity, can have. Shows the importance for us to be screening our patients, make sure they have good preventative cardiology, and really make sure that we're treating the whole body and not just their joints. So lots of great information already so far from day one of Convergence. Looking forward to sharing plenty more throughout the conference. You can follow me at Eric Dein MD on Twitter, and definitely tune into Room Now for tons more coverage throughout this conference and in the future. Thank you very much. Take care.